housekeeping items. The first thing is that as of Tuesday, our office was completely functioning remotely. So we're all working from home. It still is business as usual. Our hours are going to be 8 to 5. And I think on Friday it's going to be from 8 to 12. But it's going to be business as usual. There might be some delay in responding to phone calls and emails, but if you directly reach out to the team members that you normally work with, they're going to be very responsive and they're on it. But we're doing our best to respond to everyone's emails and phone calls. If you call the office, Rosemary, our receptionist, will be answering the phone, and then she'll be taking messages and directing the calls to whoever needs to take the call. Also, we're posting a lot of resources on our Facebook page, and that can be reached at it's only for dentists, and we'll be providing that information in a subsequent email. So we're working on sending out a mass email that will have links to our Facebook page, so you guys can see all the updates as well. And I think we'll probably be having another one of these maybe on Saturday, so that this way more people can join. And believe it or not, not all the states are doing what California is doing. So some states it still is business as usual. The next item that I wanted to cover with you is what's going to happen with the tax deadline. The extension, we're going to probably be filing extensions to file tax returns for those people that will owe taxes. We'll file the extensions on April 15th. And then for those who will owe taxes, taxes are actually not going to be due until July 15th. So if you have to write the IRS a check, you don't have to worry about paying interest and penalties until July 15th. But nonetheless, we'll still have to file for an extension to file on April 15th. Right now, we're triaging, so I'm instructing the team to basically work on tax returns where we're expecting a refund. We'll give those a priority because people who will be getting a refund, we probably want them to use the money to run their business or pay for bills personally. And then after that, we'll be working on ones that will owe, since that deadline to pay has been pushed to July 15th. I'm also going to be still doing, as many of you know, if you wanted to speak with me, you could go to my calendar, and I think many of you have a link to my calendar. You could always feel free to set up an appointment on my calendar through that link. And if you want to set up a one-on-one, I'm here for you. So what I'm doing this week and next week is I'm pretty much ignoring the tax deadline, because I feel like addressing this and hopefully providing guidance to our clients as best as we can in these unusual times is definitely going to be important. So I'm always going to be available. Like I said, it's business as usual. If you go back to one of my emails, you'll see there's a link there, a green link that has phone appointments. You click on it and it'll give you access to the openings on my calendar, and I'll call you in the phone that you specify and the time that you specify. Okay, so with that said, I just wanted to go over some things that we feel are very important for everyone to know about. By now, I hope you have maybe met with your team before you close your office. If you did close, or if you're still open, you probably should be still doing this. And what you should have been doing is maybe identifying essential and non-essential functions within your practice. Based on the recommendations that are being given by the CDC and the ADA and I think the CDA, is that you should only be seeing patients on an emergency basis. But I think, that definition hasn't been clearly defined. So we're seeing a wide range of interpretations on that. And I think we'll leave that up to each one and their professional judgment, of course. I'm in no capacity to provide you with clinical guidance on that. But some of the essential services that you will still need to keep in your practice, besides dealing with emergencies for patients, is going to be, some of it is going to be administrative and clerical functions, right? Like your people are still going to need to collect your accounts receivable. I think someone will still need to answer the phone and reschedule patients, and also let patients know as they call that, hey, you're here for them, and this is only going to be temporary, and things are going to be back to normal once this is all behind us. That the other thing that we need to figure out is, okay, well, what do we do with non-essential functions, and what do we do with the employees at this point? The advice we were giving to people was, basically, we need to furlough those employees if there's not going to be work, or at least reduce hours. But then Congress passed this Families First Corona Response Act yesterday, and we're still trying to figure out if there is any exceptions to the blanket rules that they set. I just had a phone call with Ali Oramshian this morning, and I also attended his webinar yesterday, and he thinks that there is, this is still subject to interpretations, but he thinks that this is going to exempt most healthcare businesses and practices. But we'll have an update. We'll have an update for you on that the next time we have a call, which hopefully will be Saturday, and we'll probably have another call next week. I just don't want to have these very often, because I know you're busy and you're trying to deal with other things. And again, I'll keep saying that if there's any updates, also check our Only for Dentists Facebook page, because we'll keep that updated, and we'll have all the resources there. But again, Ali Oramshian seems to think that there is an exemption for dental practices and medical practices. But again, he qualified that, and he said everything is still subject to interpretations of the Department of Labor. What would be nice is if the DOL or the Department of Labor would issue some regulations to clarify that. Well, I also read in the law, and again, I'm not a lawyer, that there is an exemption for small businesses that will be having hardships, and small businesses that employ less than 50 employees. But again, that's all subject to interpretations from the DOL. So again, as we read the law more, and as I get more guidance, I'll keep you informed. Again, I apologize, I don't have a concrete response on this issue. Also, over the last couple of weeks, I've reached out to a lot of the dental lenders, and all of them, with no exception, and this was from some of the higher ups in these organizations, they said they would be working with dentists on maybe delaying some of the payments if they are experiencing a hardship. So I know what they were saying is like, hey, if someone has $1 million in the bank, we'll probably not give any big deferments. But for someone who can show that they're experiencing some difficulties, they will definitely work with them and defer payments, or maybe do like interest only figure something out. The last thing banks want to do is to own and manage a dental practice. So for sure, they'll be able to work with you. Like I mentioned earlier, we finally yesterday got some guidance from the Treasury and from the IRS regarding the tax deadline. So tax returns are still due on April 15th, but we can file for an extension, and it's going to be an extension of time to file the return, and also an extension of time to pay taxes until July 15th. So that's great news. I would advise our practices, if they are going to owe taxes come April 15th, not to pay their taxes and defer that until July 15th, and save your cash flow, because you're going to need that. And, you know, I know right now we're dealing with this emergency, but I can tell you, if you weather the storm, and we all will weather it, God willing, that, you know, things will be back to normal hopefully soon, and it's going to be business as usual, if not better. So with a lot of the appointments that you're maybe rescheduling right now or canceling, hopefully you'll be able to catch this up if it's only a few weeks, and maybe again, you know, you and your team are going to be hungry to get back and work a little extra to do that catching up. But I'm very optimistic. And again, from our experience from the Great Recession 12 years ago, most of our dentists survived that, and actually a lot of them thrived. So, you know, I've been through at least three cycles like these, and I have no doubt that we all will survive this. We have always advised our clients to keep 60 days worth of operating cash on hand, and it's exactly for these reasons. Now, if you don't have the 60 days worth of operating cash on hand, then again, we're advising you, don't pay your federal taxes that are due until July 15th. Also, don't. California is going to be deferring that for 60 days, so June 15th. Also, hopefully, maybe you could cut some expenses from payroll, even if you have to comply with the Families First Corona Response Act. There's caps on how much you'll have to pay. So maybe we'll do another seminar on that, like I said, later, where we can discuss that more in details as we have more information on that. I did also check out the SBA website, and they have a big banner on their website for those businesses that are affected by this coronavirus. So you click on the coronavirus banner, and they have a link right there if you want to apply for the SBA loans for people that are affected by adversely by the coronavirus, for businesses mainly. Then as far as other Treasury responses we're seeing, you know, I think in addition to like the deferment of tax payments and SBA loans, we know that Congress, they're working on a new bill that's going to be like an $850 billion bill that will include payments to small businesses, direct payments to Americans who again have been affected by this. And you know, the words that we've been getting from the Treasury is that, you know, checks will be going out as early as 2 weeks. So definitely, you know, the government has been trying to respond as quickly as possible to stabilize things. Again, ideally, you know, if this thing is only 2-3 weeks, I think we should be all able to weather it, and the economy should go back up. But if it lasts longer, then we might just see some economic slowdown afterwards. I'm not an economist, so, but that's what I hear from other people in the business, and I've been getting a lot of updates from different banks and financial advisors on that. All right, so this is pretty much the updates that I have. And now I'm gonna start answering some of the questions that were asked in the chat box. So we'll go through this together. One question is, any news from government to help with business? Again, I think right now it's gonna be the SBA loans available. I'm not sure if the Families First Corona Response Act is, is really helping businesses at this point. I don't think it will. But again, we'll see as we study this. We're going to see who qualifies and who doesn't for an exemption. And we'll have more guidelines for you on that. Then again, like I said, there's going to be an additional bill that's coming out with more direct help to businesses and individuals alike to the tune of almost $1 trillion that should help stabilize businesses and alleviate some of the economic pains. Please touch on SBA loans and other available relief. Again, if you, as far as SBA loans, go to sba.gov. That's sambusinessapple.gov, and then click on the coronavirus banner, and there should be the link over there to apply for a loan if you need it. The rates are pretty good, and also most of the states like California are declared as disaster areas, so you definitely, most businesses will qualify for that. Up to, I think, $2 million of working capital. I think it's also going to be up to the discretion of the SBA. So you may go to the SBA website and take a look at that. I was looking at it earlier, and it seems like they can do everything online there. Yes, someone is asking if we are still receiving tax refunds on time. Yes, so we haven't heard any words otherwise. And typically from our experience with the IRS and the Treasury, when we're facing difficult economic times like that, they're usually very responsive. And the one thing they don't like to delay is tax refunds. And again, I'm directing my team that our focus is going to be on tax returns that have refunds, and we're going to be working on those, giving those priorities, and help get you guys the money and the refunds as soon as possible. Right now, though, I personally, and some of the, like Tammy and Rudy, some of the managers, they're focusing more on answering clients' questions. So we're also giving that a lot of attention at this point, because we understand, we need to be here for you, and we need to be here to be a resource and answer your questions. And I promise we won't be flooding you with a lot of emails to bug you, because I know in these times, everybody's trying to be helpful, and everybody sometimes, out of good intentions, they're maybe giving misinformation. So we'll try to only give you the information that we know is a fact, and anything that we feel is speculation, we'll give you big warnings. But we'll follow up with you on those items that are unanswered and give you more concrete questions to those. So deadline for extensions on July 15th is for individuals. That's for paying taxes. And that covers, because most of the dentists that we have are set up as pass-through entities. So S corporations pass the income to the shareholder, and then the shareholder typically pays the tax on the corporation income with their tax return. So the extension till July 15th covers both the personal income and the income that's a pass-through from your S corporation or your sole proprietorship. So that covers both. And that also covers your first quarter estimate. So typically on April 15th, you have your tax liability from last year. So that would be the 2019 tax liability. That's gonna be extended till July 15th for federal, and for June 15th for state, for California. Other states may have other rules, and we have clients in probably 20 states. But I know for sure California extended till for 60 days. First quarter estimate for federal has also been extended from April 15th to July 15th. So you could preserve your cash flow there. I've got a question that some clients have been sending emails to the CDA and ADA regarding objective guidelines and have received from information from the CDA. Well, if you have any information that you feel would be useful, you could share it on our Only for Dentists page on Facebook, or maybe email it to me, and I'll be more than happy to share it with everyone. So please do that. Would banks delay with accruing interest on a practice loan? At this point, I think the most, they're going to look at it on a case by case. I think that's the word I'm getting. So if you're going to have trouble making your loan payment, reach out to your lender. Maybe even copy me on the email and let them know they can speak with me, and we'll definitely work with your lender on that. But again, if you have the cash flow and you have enough operating cash, they may not be as generous, so they'll probably look at it on a case by case. It would be hard for them though to not accrue the interest, but you never know. Sometimes all you have to do is ask, right? Oh, Tammy just corrected me. Tammy Gong, I think many of you know her. Tammy says that they just extended the California tax return filing and payment until July 15th. So thank you, Tammy. So I think now California is in compliance with the federal government, and they're both in sync as far as the July 15th deadline. We have another question. Should we cancel the 2020 quarterly estimated tax payments? Well, for many of our practices, up until this week, most of our practices were having a stellar year. So I don't know about that. Again, I'm very optimistic. I'm hoping this is going to be only a few weeks. And, a lot of the crowns and fillings that you would have otherwise had to do, it'll still be there for you. And maybe just, instead of working 3.5 or 4 days, push the pedal to the metal to 5 days, and you guys can all catch up, and hopefully the team also is going to be excited about getting back to work soon. So I think let's just be optimistic, and let's not discount that this year is still going to be a good year for most of us. If it's just a hiccup, hopefully we can all recover from that. So at this point, I think we'll have to look at it on an individual basis. We're going to be continuing to crunch your numbers, let you know how you're doing, how your practice is doing. If you have access to Practice Gauge, we're going to make sure that that's updated so you guys see how you're doing. And again, we might just take a little bit of a hit in March, which will affect the first quarter just by a little bit, and hopefully again take a little hit maybe by a week or two in April, and then we have the rest of the second quarter to catch up. So I don't know, I'm optimistic. I think we'll be okay, and I think maybe what they should be doing is maybe just like they let schools out and closed gyms, maybe they should also put some limitations on 24-hour cable news. What do you guys think? I think, this is a great time for those. I mean, for us, it's been actually we're working overtime. So this has been, we're all working very hard to answer your questions and meet the deadlines. So we're working harder than ever. But if you feel like, this is, maybe you're not going to be as busy in the next few weeks, take this as an opportunity to maybe take a CE class online that you wanted to take, or maybe do things that you couldn't personally do. There's other ways, we don't only have to work and grow professionally. There's other areas in our life that we also need to build up and grow. So this might be a great opportunity to spend more time with family. But again, maintain the social distancing guidelines, or read a book or exercise, do other things that maybe we've put off. We have another question: with the SBA offering 3.75 up to 2 million, perhaps this is a good time for me to consolidate debt, all debt. I think we should definitely take a look at that if it is an option. Typically from my experience, when the government gives something, there's all kinds of strings attached. So we have to see what the strings attached are. And at this time, again, everyone is trying to be very helpful. And again, I mean, if there's no strings attached and it's a better deal than your conventional dental loan, then definitely it's worth looking at. Are we allowed to delay 941 biweekly payments? No, the IRS was very clear on that the extension of the deadline only affects income tax payments for 2019 tax liability and first quarter estimated tax. So payroll taxes are still due, and they need to be made on time. I wonder what are the terms of payback are, 10 years, 15 years. I think that's probably, again, in regards to the SBA loans. And again, we're probably gonna be experimenting with that with a few clients. As soon as I have some information, I can let you know. But typically, from my experience with SBA loans in the past, they're usually not the most friendly types of loans. They're usually also adjustable. So again, the devil is always in the details. Should we pay the remaining PTO to our staff? I think that's something you should discuss with your HR attorney. We always recommend to use HR for Health. They're great. But again, I think the key here is going to be to communicate with your team. Whether they are going to be wanting to use their PTO. I think what I'm going to do is I'm going to post Ali Ramchian's webcast from yesterday on the Only for Dentists Facebook page, so that you guys can see it, and it will answer some of those questions. Again, when I spoke with him again this morning, this is still a gray area, and especially as far as the Families First Coronavirus Act, and we'll have some more solid information later. Again, I think as far as, tax returns that are on extension, someone is asking tax return was contingent on profit sharing contribution. I would definitely advise you, if you haven't made the contribution to profit sharing, to preserve your cash at this point. We have an extension for those returns, for those corporate returns until September 15th. So I think we may need to push it to that, and again, preserve your cash flow. But I think you should still take the deduction. We have another question with regards to filling out unemployment forms. I think I probably, I'm going to have to get back to you on that one, and maybe I'll call you on the phone and figure out specifically what the question is, and then we'll look into it and get back to you on that, Dr. Phillips. As far as adjusting quarterly payments, I think I addressed that earlier. There's a couple of ways to figure out your quarterly payments. We usually use the safe harbor method, which is based on last year earnings. But if, again, I'm being optimistic here, and I'm hoping that um, we're not going to be all hurt that much by this. If they're able to contain this virus in the next few weeks. From our experience from the prior recession we had in 2008, typically after things get back to normal, demand for dentistry goes back up right away. So hopefully this thing doesn't drag out, and hopefully we don't have to adjust uh, uh, um, quarterly estimates. Again, for first quarter, we don't have to worry about that until July. We'll have to play it by ear on an individual basis and see where we go from here. As far as filling out unemployment for employees, again, we're going to have to wait and see what the Families First Corona Response Act says, like I said earlier. And I think we need to see how that applies to dental practices. The word I'm getting from HR for Health is that healthcare is exempt from that, specifically dental practices and medical practices. Again, we're going to probably wait a few days and maybe get back to you on that. Someone here said that they were already able to successfully negotiate with their lender and was able to waive monthly payments for 90 days, principal and interest. And it will be, well, it's not really waived, it's just going to be added to the loan balance. So if your loan balance is 100,000 and your payment is 100,000, $1,000 a month. So if they defer the payments for 3 months, then now your loan balance at the end will be 103,000. So, but that's great news, and good job for being proactive. Someone is asking, can family members and maybe even officers in a corporation file for unemployment? Again, the key here is that you're not getting any income from the company. So if you could stop taking wages and stop taking draws from your business, you might be able to qualify for unemployment. You probably will have to put on the application that you are the business owner and you've been exempt, you've been affected by the coronavirus. That would work if you have been paying into the system. If you haven't been paying into the system, I don't think you would qualify for unemployment. So the key here is if you've been paying unemployment insurance. And again, if you're going to be taking unemployment, please do not take wages or draws from the corporation. And make sure you don't have any other income coming in, because they will ask you, are you getting any income from your any other sources? As far as property tax payments, we haven't heard anything yet from the counties, and that may be also, usually the counties get word from the state, so we'll have to get back to you on property tax payments. I know that's coming up in a couple of weeks in California. I think it's April 10th. We'll get back to you. I know a lot of municipalities have issued laws that prohibit evictions for both residential and commercial in the next couple of months. But I haven't heard anything about property tax. But we'll keep an eye on that, and we'll get back to you. Property tax. Yeah, as far as people utilizing PEOs, yeah, I think these might be subject to different rules. You may want to reach out to your PEO directly and figure out what their advice is, because technically they're not really your employees, they're the PEOs. employee, I guess, or maybe reach out to your HR director. Um, we also found out that, thanks for sharing this, Naveen, that Live Oak is deferring 3 months, and also B of A will be able to defer 1 or 2 months. Again, it's going to be on a case-by-case basis. Regarding, again, payroll next week, I'm hoping we're going to have an answer for you, like I said earlier, hopefully soon. One client mentioned that their county was able to maybe set up payments, monthly payments, for taxpayers instead of just paying it all in one chunk on April 10th. So that's good to know. Thank you for sharing that information. Well, it sounds like the property tax um, uh, uh, is on a lot of people's minds, and we'll definitely get you guys some answers for that, because it sounds like it is a big question, especially for our clients that are in the Bay Area and they have huge property tax bills. So, and also in Texas, I know Texas also have pretty heavy property tax as well. So we'll get you guys some answers on that. Yeah, I mean, again, I mean, Nirav was asking if we're only opening for emergency, can staff apply for unemployment for the hours that were cut? That usually is the case, but now they threw this kink about Families First Corona Response Act, so we're gonna have to kind of give you an answer on that pretty soon. We're advising people to reach out to HR for Health to get some guidance. And again, I'll put Ali Oramshian's guidance on our Only for Dentists Facebook page. Someone is asking, if we apply for unemployment as a corporate officer, could this complicate the collection of any small business relief that may be in the pipeline? Well, number one, we don't know what's in the pipeline yet. I know we're saying there's going to be big and bold actions, as the president put it, but we'll just have to wait and see, and we'll have to see what kinds of strings attached they are. But at this point, I think we have to use whatever is available. Someone is asking a very good question from Dr. King. Any tax credit for employees who provide paid leave to employees? Yes, it is a tax credit that applies to payroll taxes, and specifically Social Security part of payroll taxes. So for those employers who are going to be complying with the Families First Corona Response Act and pay that family sick leave, FMLA payments, there's going to be a payroll tax credit. And it's going to be also, if the payments are more than the tax credit, then they will give, the government will issue a refundable credit, and you'll actually get that back in the form of a paycheck, in the form of a check or a refund check from the government. Good question about specific guidelines on making monthly lease payments. Again, I think before missing a lease payment, you should reach out to your landlord and see what you could negotiate with them. Again, it's my experience from the last recession is it's usually a case by case, and usually they will ask for financial statements and bank statements to just see, if you really have the cash to do it, or you don't have the resources to pay rent. But before missing any loan payments or lease payments, please reach out to your landlord and your lender. And also, you may want to reach out also to your dental supplier as well, because dental supplies are typically in a practice are usually about 7%. And if there's any big bills that you owe to a dental supplier, maybe you could get that deferred a little bit. Um, as far as specifics on paid leave, we're still, this is just still brand new law, so we're trying to learn about it, and then we'll get back to you on that. Look for another maybe update in the coming days, hopefully by Saturday. If not, then early next week. I know this is definitely on everyone's mind, and I'll see even if I can bring Ali Ramshian on the call as well, so he can answer a lot of your questions. He's a good friend of ours, and I know he's always a great resource for our clients. Any other questions? I'm sorry I can't answer all your questions. This is just a very fluid situation, and we're learning as we go. And it's also, as far as guidance from the government, sometimes they give these public statements, but then the devil is always in the details, and the details have been sometimes very slow and very and it takes some time, and rightly so. We understand they're operating in an emergency, so we're not definitely blaming anybody, but this is all new to everybody, and all I know for sure is we just have to be optimistic and do what's right for our teams, do what's right for our patients, and take care of each other, and we should be all here for each other. So we'll keep praying for everyone's safety, and thank you so much for attending. If you need anything, you know how to get a hold of me. You have my link for my calendar. You could always schedule appointments on my calendar, and I'll call you, and then reach out to my team. They're usually very responsive to emails. I'm experiencing now maybe 1 or 2 day delays sometimes in answering emails because of a lot of phone calls that we've been getting. But please be patient with us, and again, I promise you, we'll all get through this in no time, and hopefully, when it's all said and done, we're all going to be better off. Thank you again, and stay safe, and I'll talk with you soon. Thanks.